Hello, everyone. I hope I'm visible and audible to everybody. Can you tell me whether I'm visible and audible?
Yes.
Okay, thank you so much. So, welcome everybody. Myself, Dr. Yamini Ramesh from Asha Homeopathic Academy, and I welcome everybody to this third session of our cancer webinar series. And I just want to give you a little bit uh, glimpse about Asha Homeopathic Academy and Vitality Clinic. So we have organized a lot of webinars, seminars, classes, case discussion, and group book readings also. We started this academy in 2017, and we have a lot of online and offline courses. So, when lockdown happened, we started organizing these free webinars, and which were really fulfilling, and a lot of learning happened for us and for the participants as well. At the same time, we started a very innovative program called e-clinic setup program, which helps the doctors to set up their online clinic and increase their online visibility. We have also started other courses like therapeutics course, clinical course, and Need the Foundation program, which is a signature program from Asha Homeopathic Academy. It is a 4-month long program where we teach every basic in detail so that you feel empowered to practice homeopathy with good confidence. And Dr. Vaibhav started Homeopathy Junction. Homeopathy Junction, this is an Instagram page and also a Facebook page. And this is a page where, we want to integrate everything, every update related to homeopathy. So we put, all the news, all the jobs, events, quizzes happening in the fraternity across the globe. So, this is one page which you should definitely go and check so that you get all the infos on Instagram. And now we are presenting this cancer webinar series. It has 5 sessions. We are doing it from 24th Feb. This is a third session of the series, and you can watch all the free sessions on YouTube. We are already live streaming them on YouTube. And also, I want to thank Dr. Hafiza Malik. Dr. Hafiza is from Gujarat. She owns Vitality Homeopathic Clinic, which is a one-stop solution to a proper means to achieve the health and most people desire. And she strongly believes that a healthy outside starts from healthy inside. So she's been practicing from so many years now, and she's a very motivating and a nice colleague whom we have with us. So thank you so much, Dr. Hafiza, for collaborating with us and enabling us to actually organize this session. She's a consultant in Surat. She's also teaching in the Vidyadeep College, and she successfully manages a large number of cases of Down syndrome, autism, ADD, and a lot of learning disorders. Her special interest in serving humanity by providing better health to the community leads her to work with various NGOs. She's involved in a lot of social work and counseling sessions also. Thank you so much for being with us. And today, I want to also introduce our speaker of the day, Dr. Shruti Shah. She's very well known. She's also from Gujarat. She's a senior homeopath and teacher. She did her MD, Ph.D. and practicing from more than 20 years in Gujarat. Her area of specialization in treatment of cancer with homeopathy. She has published many research papers in prestigious journals and international conferences. And recently, she has also authored a book on treatment of breast cancer, which is a very, very helpful book. You must, go through the book. She's also one of the founder members of Cancer Research Foundation named Prayas and have got wide clinical experiences experience. She is also an associate professor of Materia Medica at university and teaching the subject from almost like 15 plus years. She is also honorary faculty at London College of Homeopathy. Ma'am, you're welcome. We are very, very grateful for your valuable time that you're going to share amazing cases and knowledge with us. Really looking forward to session. And if you have any queries regarding this webinar series or anything else, you can contact us. So these are the contact numbers and email addresses where you can email us. Now, I won't waste much of your time and we'll head forward and request Dr. Shruti to please share her knowledge and wisdom. Ma'am, you're mute. So till ma'am joins, I want to ask everybody that hope you enjoyed the last two sessions of Dr. Hardik and Dr. Jyoti. So if you have any question related to their sessions or related to your cancer cases or difficulties in practice, please write back to us. We will have a panel discussion at the end of the series.
I'm very sorry to all the participants and Dr. Yamini. Am I clearly audible, visible?
Yeah, ma'am. You're
sorry, I had to go to emergency for a lung cancer patient.
No problem, ma'am. We totally understand. Thank you for your valuable time. And we understand your practice is very busy and that is much needed also.
Okay, so let's see. I was thinking what to start with. Just a minute. So it comes to breast cancer. So I will start where I started with. Is it? Am I clearly audible, visible? Because I'm traveling and I'm not very sure. I just rushed back from the hospital and I'm not very sure if the setting is perfect. It's perfect?
No, it's perfect. You can also share the screen. I have enabled the screen sharing and you're audible and visible perfectly.
Okay. So when I started treating the breast cancer patients first in my clinic, I was convinced because when we were student in our BHMS, we have studied that Conium is for breast cancer, Asteria rubens is for breast cancer, Phytoleuca is for breast cancer, and they were written in our Materia Medica with so much authenticity and confidence that I knew that breast cancer patients can be helped with homeopathy. But when it comes to clinic, when you take a breast cancer patient, the Materia Medica and repertory we have currently with us is not sufficient for a beginner. So you are supposed to get lost that what is happening, how to take care, when to give Conium, when to give Phytoleuca, when to give Asteria rubens, when to prescribe constitutional, when to prescribe Nozod, when to prescribe pain remedies. So you have help available at your hand, and you have no fixed protocol, no definite direction, how to start with, how to go with. But yes, we have help. So initially, until now, it is very difficult to tackle cancer patients. But even I'm convinced, if anything in the world can currently cure cancer, there are only two things. First is miracle and second is homeopathy. I'm convinced that we can certainly cure cancer patients, but yet we have miles to go. So what I started with, that I started studying all the I listed the breast cancer remedies. And hello, Dr. Yamini, it's everything all right?
Yes, ma'am. Yes, everything.
Okay, you can come on the screen. Yeah, perfect. So when I started, I made list of all the breast cancer remedies from repertory, and I've started studying them one by one. I have studied almost 75 breast cancer remedies. I have studied breast cancer as a disease, and then I have made a protocol which makes treating breast cancer patients easier. Yet I am saying we are on the way. We cannot say definitely. So it is always a difficult situation when you take a breast cancer or any cancer patient, because it's not going to be easy, and we are still lacking in our expertise. But yes, definitely we can. So yeah, it's not very safe and sound. You need to be very careful. You need to be very clear to patient about your availability of skill and your lack of skill. And yes, you can always go on, because we have a treasure with our in our hand. First, we must understand. I'll start with a case. Dr. Yamini, is my PPT is visible? Are my PPTs visible?
Yes, yes, ma'am. It is visible. Just make it full screen.
Okay, okay. So how about them now? Clear?
Yeah, it is clear, but can you make it full screen, like the slideshow mode?
Just not clear yet. I think this is what I can do.
Okay, no problem. It is good. No problem.
Okay.
Yeah.
So I'm starting with a case of breast cancer. She was a lady in her 60, and she had a left breast cancer. She came to me because after chemo, radiation, and going through the surgery of left breast, after a couple of years, she developed the same lesion, cancerous lesion in the right breast. Sorry, left breast. It was initially there in the right breast, then it come to left breast. So she was afraid and did not want to go to the cycle of surgery, chemo, and radiation again. So she came to me that now I don't want to, I'm not physically, mentally ready to go through the same, because again it has occurred. And all you can see in the screen that there is a small ill-defined hypoechoic lesion in periolar region of right breast at 10 o'clock position, recurrence, and small cyst, so right breast of benign cyst. I took her history, and her mother had lung cancer, and it was right to left. And other symptoms were present of lecaninum, and lecaninum is the remedy which is prescribed by Dr. Kent, that when breast cancer patient goes from right breast to left breast, and she had a positive history of cancer in the family. Her mother had lung cancer, and she got married very late, and she had this issue of victim and aggressor. So lecaninum was coming as a remedy. So I prescribed carcinosin and lecaninum for 1 month in the November. What happened in 1 month, that the lesion became less painful, it became less evident, but still it was there and it wasn't improving. But the pain subsided, patient was mentally much better. So I retook the history, and I found that she took lots of hormonal therapy for conception, but she didn't conceive ever, but she took lots of hormones. So see, this remedy, some of us might have heard the name, some of us might not have heard the name, that is Aristolochia clematis, that I given her for a week or 15 days. I do not remember it exactly because it is an old case. But Aristolochia is the medicine like Nux vomica, for allopathy medicines. We give Nux vomica to nullify the effects of allopathy medicines. Similarly, when patient has taken lots of artificial hormones to nullify the effect of synthetic hormones, Aristolochia is the remedy. So I gave her Aristolochia clematis in 200 potency for a week or something. And patient came to me in November. We took the history in December and the follow-up in January. There was no cancer seen. It disappeared. Axilla was clear, breast was clear. And so this was kind of the fastest breast cancer patient ever cured with any therapy, known medical therapy. As I said, it can happen with miracle, but never with medicine. So this was in beginning of my cancer practice, and I was stunned that what happened, how can it get cured, because this is what I'm sharing is my success. But before coming to the success, I have gone through a series of failures, struggle, half responding, partial responding, losing patients, not able to being help them properly. So this was like, I was stunned. Yeah, okay, what happened? And can homeopathy do this? And yes, homeopathy has done this. So this case was an eye opener for me also, and I started studying our cancer remedies in more depth, and started studying breast cancer in depth. And this is what I have learned so far. So what happens when a cancer patient comes to you in the clinic? So there is no one approach, not one single definite strategy that we can cure every cancer patient with, because it has multiple presentation, multiple facets. So each time we need to have an individual approach. So with the case, I have started that with the help of only 3 remedies, carcinosin, lecaninum, and Aristolochia, we could cure a breast cancer patient. We could cure breast cancer in 1.5 months, right? So this was a positive case. But how to take all the cancer patients, how to deal with them when they come to you in the clinic? So there are different type and category of patient. First patient is a precancerous lesion. A patient comes to you, then we know that Angelina Jolie went for total mastectomy because she had that B6 gene, cancer positive gene, and BRCA mutation gene positive in her family, and she was having threatened. So going for total mastectomy, is it necessary? I think if we can use, when there are such a strong family history of cancer and there are precancerous changes in the breast, the best strategy to take is to use a constitutional remedy and a nosode, because family history means nosode and constitutional means remedy means the person by themselves. So these are the cases when you alternately use this nosode and constitutional, you can really help the patients very much. And this is the place where you are most successful. Like we get so many patients of erythroplakia, leukoplakia, trismus, when they are threatened that they can have malignancy anytime in life, and they do not have any definite treatment. So at these places, at this juncture, homeopathy is very, very useful. And I repeat, the strategy we use is judicious use and alteration of constitutional and nosode, right? Then comes the most challenging, a patient with well-developed primary cancerous lesion. So this is the most challenging scenario, because there are the patients who do not want to go for surgery, they don't want to go for chemotherapy or radiation, and they want to continue homeopathy. And so many times these are the patients who have relapsed. So they have gone through the trauma and they have realized that this trauma is not worth repeating. They don't want to go through this like the previous case. They don't want to go, but they have this cancer developed and they don't want to go for, or there are few virgin cases when patients start trusting you, they would like to try homeopathy firsthand. So these are the cases where you need to be very clear and very particular and very confident, and only start a case when you are confident, or take help of the seniors or experienced patient, and never give a patient a guarantee. The name of our foundation is Prayas, right? Means we are giving our best effort. We do not know what will be the outcome. This is sad, but this is the reality. So in 20 to 30 patients, 30% patients, yes, we are able to cure, but in 60 to 70% patients, we are struggling or we are not cured. So you need to be very careful and vigilant. You need to have regular checkup. You need to need to have regular cancer markers, and see if your medicine is helping the patient or not. And if you are not very sure and very confident, don't take such patients. So when you have a primary malignancy, what are the points you will consider when a patient comes to you? So these are the things: the emotional grief, mental trauma prior to the development of cancer, addiction, if any, exposure to carcinogen, past history and family history, and of spouse too, and detailed case taking. Why emotional trauma? So Dr. Sarkar says, and we always believe, nothing happens if nothing happens. Dr. Hardik also shared the same thing, that it is not easy. Our body is so immune to develop cancer. A patient has to go through lots of mental, physical abuse. Then only the system develops a pathology like malignancy. So there will be a lots of things which would have happened prior to before the patient has developed such advanced and challenging pathology. So always go with that, what is, and you will definitely find some unresolved grief, trauma, and if they are prominent, then take note of it. It is very vital for prescription. Then what are the addictions a patient has? Like tobacco is well linked to homeopathy. Then exposure to carcinogen. Currently, I had a patient who was working in the mines and had lung cancer. So I need to even antidote the asbestos or dust and their effect on lungs. Then past history and family history, because I think cancer is very much, it runs in family, and we need to use nozodes very judiciously if the patient's family and a spouse, yes, spouse also, because I think, and I truly believe, and I have done a study, that cancer is venerally transmission. It gets sexually transmitted. If the spouse or spouse family has strong cancer history, one is more susceptible to develop cancer. And yes, of course, detailed case taking. And Dr. Hahnemann has said that one remedy, law of minimum, one remedy. But doctor, but I tell you very clearly that one remedy at a time, one remedy, not all the time. Dr. Greimer has said that frequent change of remedy according to presenting state can be of very much useful. So when you treat a cancer patient, see what is the presenting state, where the energy is lying. So one remedy at a time, not one remedy all the time. Remember this golden rule, because patient will have frequent change of state, and according to you need to prescribe the remedy which is coming on the surface. So we do not, the only strategy we have, that when we start treating a cancer patient, we treat what is there on the surface, where there is an energy is lying. So if, for example, yesterday I had treated a cancer patient of neuroblastoma. The patient was from Turkey, and I was taking an online case. So patient was telling me that it started with severe stomach cramp, diarrhea and vomiting, and later on, as this diarrhea and vomiting was not responding to the gastric treatment, they sent the patient for CT scan, and they found that there are lesions in the brain. So generally, as a rule, when there are gastric plus neurological symptoms, the remedy to start with is Ethusa. So I was eager to prescribe. I was about to jump to prescribe Ethusa, and then I found that the patient, the baby's mother was taken to the jail because of some political reason. The father was also under the threat of being arrested at any moment, and the child was constantly holding the father and was telling that I want my mom back, I want my mom back. So the entire energy of the case was lying on the emotional side. There is a threat of getting arrested by the police, the constant clinging to the parent and constantly remembering mother. So the prescription, though there is a strong aversion to cheese, there were definite sweat and thirst symptoms, peculiar position of sleep. Generally, when we prescribe for cancer patient or any patient, we lay more emphasis on this definite physical symptoms, which are very characteristic because they will never mislead you. But here the emotional and mental picture was so prominent that I prescribed stramonium followed by cuprum acetate to the patient because it has this mental picture as well as neurological, pathological, both together. So you have to remember where the energy is lying in cancer patient. Like one cancer patient comes to you, they will talk nothing but of a local pathology, that I'm having this ulcer, it is so much painful, it is the ulcer has a defined out look, or like brown border or blue border or black base, and it is oozing, it is offensive, and there is so much local pathology. Patient complains nothing but of local pathology. At that time, forget the emotional part, don't go into that aspect and prescribe what is local, like where is the side and location of the lesion, what is the kind of sensation, what are the modalities, and what kind of carcinoma is there, or histopathologic or anatomical, and where the system and organ to which metastasis has taken place. Like if it is a breast cancer which has metastatized to lung cancer, the remedy could be different. If the metastasis takes place to bones, the remedy could be different. If it goes to liver, the remedy could be different, because we have local symptom, we do not have much general. And when you will start practicing cancer patients, you will have more of this kind of patients who do not have well developed, or like Dr. Hanuman said, local, I mean, what the word he has used in organon, like when there is a poor symptom, I forgot the word, but when there are lots of local symptoms, or paucity of symptoms, right? Because vitality is so poor, so there will be not many symptoms to prescribe upon. In this scenario, you have to prescribe on the local symptom. Go where patient is taking you. If patient is taking you to the mental symptom, go there. If patient is taking you to the local symptom, go there. If patient is taking you to the constitutional symptom, go there. And if patient is taking you to the trauma, to start your remedies like ignatia or staphysagra, or any other aconite. If the patient is experiencing fear, if patient is extremely anxious, go for arsenic. If patient is complaining of pain and nothing else, the best remedy to start with could be chamomilla. So go where patient is taking you. So as I said, there will be patient with primary cancer and secondary cancer with metastasis. These are also very difficult cases, and when there is lots of metastasis, and I've seen in my practice that patients who have gone for lots of chemotherapy, then radiation, they have very poor prognosis, because this remedy, this medication, they take away their vitality. Being a medical practitioner, see, our medical science has learned to measure everything. I mean, how much potassium, sodium, phosphorus you have in your body. There are wonderful pathological markers and investigations. But what is the governing force of life? That is our vital force. We have not yet learned to measure it. I mean, how much vitality we have. We know that if an electric instrument is run by electricity, for its proper governance, a kind of this much voltage is required. When it comes to life, we do not consider the life force. So the things which take away the life force are never going to help cancer patients, and medical science has not still recognized. Corona has taught us that immunity is important. What is immunity? It's a kind of the vital force, the measurement of life force you are having. So if you are vital, if the patient is vital, the prognosis is good. If patient has poor vitality, the prognosis is never very good, and we need to consider this thing. When a patient comes to us after 7 years of experience of treating cancer patients, we generally come to know by the kind of vitality patient has, that if patient is going to respond positively to the remedy, or we are just going to help to palliate these patients. And generally, when there are secondary metastasis, we switch over to water potency or LM potency, and we use lots of pathology, drainage, and pain remedies, because there will be more of the local symptoms. Then something where homeopathy is of tremendous use is for prevention. We have two types of prevention. When a patient has, as I discussed earlier, a patient is having a very strong family history, then we can give a constitutional remedy and nosode. And a patient is in the period of remission, and then they have gone through chemo, radiation, and surgery, and 70 to 80% patients will go into relapse within 5 years. These are the statistics, except a few cancers like lymphoma and hormone positive breast cancer. They will not have a fast relapse. So most of the patient will go into relapse within 5 years in spite of all the therapy. So when they come to us, just after that they have taken the allopathy treatment, and if we give them good homeopathy treatment according to their state and symptoms, I have seen within 7 years that my patients tell me that we have gone for surgery, and since last 7 years we are taking homeopathy. And from the group of patients, generally these patients have a group who have taken only allopathy and have not taken homeopathy. All of them are not alive, but as we have opted for homeopathy, even after 7 to 8 years, we are the only survivors. So this is the area we can really help patients the most. And the survival rate and the period of remission is very will be very longer if immediately after the surgery patient goes and opts for homeopathy. And generally here also we need to go by state. We need to address the emotional issue. We need to give a good constitutional. We need to give a good nosode, and anything which is intermittent. You will find that old symptoms may reappear during this phase, so you need to go judiciously as it is described in our Organon of Medicine. This secondary prevention, that is also, and we need to have a good statistic. Then there will be patients, they will come to you for relapse, to prevent the relapse, and they will have all the side effects of conventional therapy. So here there will be no meaning of going directly to constitutional or nosode, but see what is happening. So this, what could be the side effects? There will be hair falling. So we have medicines like selenium, thallium, carboveg, natramure, etc. for this hair falling. That there will be cachexia. So we need to use our marasmus remedies like abrotinum, then acetic acid, because it is called cancer cachexia. They have gone through malignancy and this exhausting therapy. So we need to address and bring patients to their original weight and build up. Then the worst two things are leukopenia, anemia, thrombocytopenia because of the side effects of chemotherapy. So we need to use medicines like Crotalus horridus, bone marrow, X-ray, radium brome, phosphorus, cantharis, likewise. Then hypoproteinemia, then we need to put them in a good diet. A good diet is very, very necessary to treat cancer patient. GIT disturbances, which can be cured with like lots of vomiting, diarrhea with chemotherapy. So we need remedies like Ipecac, Nux vomica, China, Carboveg, etc., arsenical, etc. to help them. Then there are sometimes secondary cancers due to side effect of chemotherapy or radiation. So we need to use these remedies as well. There are radiation burns. I had one patient whose jaws was visible. There is a huge non-healing ulcer in the jaw after the radiation, and patient was advised for a graft, which was very expensive, and patient was hesitant to go for one more operation, graft surgery. And it was so bad, the entire mandible was visible after radiation. It was post-radiation side effect. So I started treating him with, I think, radium brome and calendula alternately. And within 15 days, there was like the fantastic surgery happened naturally. I mean, what an expert surgeon's hand cannot bring. That type of healing and automatic graft happened within 15 to 20 days. So these our medicines are very useful when there are radiation burns. There are non-healing ulcers and wounds, so we need to use medicines. Likewise, post-surgical complications like septicemia, then pain remains, lymphedema. So there are medicines for them as well. So we need to use these different strategies. Then mental trauma, anxiety, and fear psychosis, because once a patient comes to know that they are going to have they have cancer, they will react emotionally very differently. So sometimes we need to bring it down. We need to correct that state first. It is due to situation. It cannot be their own state, but it is like due to maintaining costs. So we need to correct that. Like we need to use medicines like aconite, gelsemium, argenticum nitricum, or ignatia, because when they are showing that I'm very tough, I'm very strong, nothing is affecting me, but innerly they are shattered. Remedies like agrimony, when they keep a smiling face in front of the family, so that family do not suffer, but they grieve innerly. When they are so much depressed that the world has broken for them, and they have lost all the help. At that time, we need to use remedies like gelsemium or arsenic alp, or when they are panic. So many times we start treating cancer patients with aconite, because when they are diagnosed, we need to give even family members aconite. And there are sometimes depression, then we need to refer the medicine which has said that despair of recovery. There are suicidal tendencies also, which can be helped with aurum metallicum or natrum sulph. So likewise, and we use biochemic supplements and back flavor remedies and mother tinctures also in a great deal when the pathology is very advanced. And yes, when I started my cancer clinic, the most of the patients who came to us were those where doctors have said, yeah, we cannot help them anymore. You take away them to their home as much as safe possible. So these are the patients who were where main aim was treatment, was palliation. And believe me, it does a wonderful work. But we need to master our pain remedies and ulcer remedies and sleep remedies and emotional remedies. So when they come to us for palliation, with homeopathy, we can really help them to pass away last days of their life so peacefully, because the patient who in the last days of life, you will find there is lots of agony, there are lots of unresolved trauma, extreme physical suffering. And when you use homeopathy medicines with them, you will see the difference. The patient was having so much despair, physical and mental, and they spend the last day so peacefully, smiling and with so much ease. So we need to have a separate materia medica and therapeutic for palliation. So there is a lots of work to do then in cancer patient, that we have to have a total palliative care remedy list, and their repertory we should have a side effect remedies and their indications and their repertory. We should have the proper malignant remedies and their repertory and their materia medica. So there is a huge task is awaiting for us homeopaths, and there is a tremendous potential that how we can help cancer patients with our this wonderful homeopathic remedies and this beautiful science discovered by Dr. Hahnemann. So this is what I already talked about. So when it comes to breast cancer, just Dr. Yamini?
Yes, ma'am, I'm here.
Yeah, is it everything going well?
Yes, everything going well, ma'am.
Okay, and how much time do we have? Because I'm little lost and I have because I just rushed from the hospital, so I'm not very.
We have time, ma'am. You can go ahead. We have time.
Okay. So I'll quickly go through. When it comes to breast cancer patient, what are the things we need to ask? So first is menstrual gynec and obstetric history, because these are the hormone things and they will help you decide a lot that what are the peculiarity and what are the insults, I mean the hormonal insults or surgical insults a patient has gone through. So what is very vital is to ask patients menstrual gynec and obstetric history, then history of taking synthetic hormones, because I certainly believe the synthetic hormones which female take for contraception, for deferring menstruation or for infertility are very much harmful to the system, and one must avoid, shouldn't take them at all unless it is a dire emergency. So this is also very important to know, as in last patient, the first cancer case we shared, that aristolochia, after giving aristolochia, I came to know that patient has taken lots of hormonal treatment for fertility, and aristolochia just to nullify the effect of hormones I gave and how it cured the patient. Then history of lactation, if patient lactated well, was there any trauma, injury or abscess, or there was absence of lactation, or any medicines were taken to bring lactation. These are also very vital history. Then injury to breast. So I mean, out of 30 out of one patient, breast cancer patient will have a history of injury to breast, either during sex life or when during handling the child or when breastfeeding. So you need to take care of this also, and give a proper injury medicine is required. Then what is the sex life, because it also plays a vital role. 70 to 80% of breast cancers are due to hormonal disturbance, and history of conventional treatment taken. Then allopathically we have allopathy, I mean, according to modern medicine and pathology, we have three types of breast cancer: hormone positive breast cancer, Herceptin positive breast cancer, and triple negative breast cancer. Why we need to know this? This is also very important. What are hormone positive breast cancers? Because the malignant cells are reactive to hormones, like estrogen positive breast cancer. There could be progesterone positive breast cancer, and treatment is also treatments are also given according to what type of breast cancer patient has got, like anti-estrogen therapy or anti-progesterone therapy will be given to hormone positive breast cancer. There is Herceptin positive breast cancer, where monoclonal antibodies will be given, and there will be triple negative breast cancer, which has the worst prognosis and very high chances of metastasis, where adjuvant chemotherapy like cisplatin, doxorubicin, etc. are given. And hormone positive breast cancer has good prognosis with anti-estrogen medicines. So we also need to know that what kind of breast cancer patient is having. And 70 to 80% of cancers fall into this hormone positive breast cancer. And they are given anti-estrogen drug tamoxifen most of the time, or aromatase inhibitors like letrozole, and they reduce the estrogen. But this tamoxifen can also is a threat that it can give rise to contralateral. It is itself is carcinogen and can produce pathology like contralateral breast cancer. And this I've already shared. Now I'll see. I've said that I've worked into breast cancer remedies, more than 75 remedies of our materia medica. So I will share a few of them here. So one is sarsaparilla. See, the first in the list is sarsaparilla. Now we know that sarsaparilla is for what? It is for renal, and it is a renal pathology. It is a medicine for skin. It is a medicine for marasmus. But yes, it is a medicine for breast cancer as well. It is written in bold in our materia medica. I had no idea that sarsaparilla is for breast cancer. So when I studied, I found that it is a weed from Smilex family. It is a very damage tolerant plant capable of growing back from its rhizomes after burnt or frozen, right? Cryotherapy do, radiation do ya काट डालो, फिर से plant उठ जाएगा. Doesn't it sound similar to malignant cells? Right, and in one of my research is also that most of the cancer remedies are prepared from weeds. Weeds are the plant. Whatever you try to pull them, kill them, cut them, they will grow back. And most of our cancer remedies in homeopathy are prepared from this weed. So this sarsaparilla is also a kind of weed. It contains this plant. Now let's go to the phytochemistry of this sarsaparilla. It contains steroids which exhibit action like glucocorticoids, testosterone, and progesterone. So this sarsaparilla has lots of testosterone in them. It has lots of progesterone in them. And this glucocorticoids and testosterone damage kidney, and that's why we have lots of renal pathologies and diabetes. So sarsaparilla can be given to which patients? Which has lots of testosterone and progesterone. See, when there is lots of estrogen, patient will be fat and plumpy. And when there is lots of testosterone, patient will be more masculine and thin and lean. And you see this sarsaparilla comes under marasmus. So it will be given to the patients who have thin and more muscular kind of build, and less of fat and plumpy, and female curvature will be less. And yes, diabetes. See, excess of testosterone and progesterone mix when deficient of estrogen, which leads to poor skin health, and we have many skin pathologies like raggeds, cracks, herpetic eruptions, which are generally aggravated before menses in homeopathy, as during premenstrual period, estrogen level declines naturally. See, what estrogen does to the skin, it makes them supple and soft. So when we touch a female's hand, a male's hand, there will be a stark difference in the texture. Female will have softer and supple skin, male will have rough texture. So when there is less of estrogen, more of estrogen, the female skin will become very rough and dry. So there are more of cracks and raggeds. And as this is when naturally estrogen falls down during menstruation, the skin eruptions will be aggravated before menses. So one of the leading indication to give sarsaparilla is the skin eruptions, which gets aggravated before menses, and then the skin is very rough and dry and cracked. And in fact, sarsaparilla is used traditionally as a skin cleanser, right? And if we study sarsaparilla in phytochemistry, it is a well-proven remedy in current research for cytotoxic and anti-apoptotic properties for treatment of cancer. See, it is already proven in modern medicine by recent scientists that this sarsaparilla has a wonderful role in treatment of cancer. But what they do generally, that they make the alkaloid similar to sarsaparilla in laboratory, they try it over the tissue cells, and then they come in the market with the synthetic version of sarsaparilla. But they have already proven that sarsaparilla has good role, and homeopathy doctors also knew that before these experiments that sarsaparilla has a very good role in cancer. I mean, especially breast cancer. So even it is, they say homeopathy is not scientifically proven. Yes, it is proven. See, I've mentioned that where it is. In which science it is. It was published in 2015 that sarsaparilla could be a very good anti-cancer drug, and before 100 years our masters have said it. Now, as I said, that when there is a lots of progesterone in sarsaparilla, so it is a medicine for progesterone positive breast cancer, right? What does the progesterone does? So progesterone will have this dimpling of breast and this PUD orange appearance with inversion and retroversion of nipple. So when there is a progesterone positive breast cancer, such appearance which is being shown in the side will be there of the breast. And if you read sarsaparilla, before our master knew that it has lots of progesterone, it is already listed as one of the remedies for retroversion or introversion of nipple. So when you have a progesterone positive breast cancer with retroversion of nipple, think of sarsaparilla with rough dry skin, which is aggravated before menses, and lots of marasmus and loss of weight and masculinity about the appearance of the body. Progesterone makes one lose weight and is responsible for pumping the fluid out of the body. That's why it's used as a kidney cleanser. Sarsaparilla is one of the leading remedies for emaciation of the body where skin hangs loose in the fold. This makes us this remedy indicated in cancer-related cachexia, atrophy of mammae, and wilting of nipples with suppuration. See, progesterone also produces kind of sadness and gloominess affecting the neurochemicals, and its characteristic symptom of sarsaparilla, sadness accompanying pain. So progesterone makes one sad, and sarsaparilla has very striking symptom that gloominess or sadness along with pain. Like in chamomilla, we have irritability with pain. Sarsaparilla has got gloominess with pain. What are other homeopathic indications? Thirstlessness, salivation, and halitosis, like mercury. Like sepia, there is a symptom. These are the homeopathic indications of sarsaparilla. No appetite, no thirst. The thought of food is disgusting related to sepia. That nightly bone pains means there will be metastasis to bones. And fig warts and red warts. These are also one of the characteristic of sarsaparilla. Warty, thirstlessness, salivation like mercury, disgust for food like sepia, and bony metastasis. Then these are the menstrual symptoms: retarded urging to urinate preceded by menses, itching eruptions on forehead during menses, moist eruptions in right groin before menses. Then endometriosis, abortion, disposition to intolerable stench on genital organs. These are the homeopathic symptoms, and these are the breast symptoms like retraction of nipples. Nipples are small, withered, and unexcitable. Shearus of the cancer of the breast, suppuration of the breast, mammae atrophy, and nipples. See, again, testosterone. So there will not be large breast, but atrophy of mammae. Right? This is all about the sarsaparilla. One more remedy we will quickly go through is Aristolochia clematis. I have already mentioned it in earlier case. So this is the medicine which has lots of estrogen. It is used as birthwort or snake root, and it was used in the treatment of snake bite and promoting birth. It was used to induce labor because it is abortifacient, and it was also used as contraceptive. So you understand why I was saying you that when there are lots of hormonal abuses, start the treatment with Aristolochia clematis so many times. So there is a lots of pathology which I have undergone the study. It induces lots of prostaglandin secretion, right? So that's why it produces cervical dilatation, and it excites COX-2 and interleukin-8 pathways. This but I'm not going into detail of this phytochemistry and where it works. But if there is one thing I would like to tell, that this Aristolochia is the medicine which is banned by modern medicine to use as herbal medicines. Why? Because it is a known carcinogen. In a weight loss clinic in Taiwan used this Aristolochia for weight loss because it has lots of function on bladder. And they found that most of the females who took this Aristolochia developed bladder or breast carcinoma. So it is a known carcinogen. So when it can produce cancer, it can cure cancer according to homeopathy. So that's why this Aristolochia yielded so much fast result in the first case which I shared. It produces excess of estrogen. So it is a medicine for estrogen positive breast cancer. Then there are lots of urinary symptoms also. And if you go into homeopathy literature, it is a hybrid of Sepia, Pulsatilla, and Arnica. See, it had lots of injury like Arnica, and nothing has happened to me like attitude. Pulsatilla like craves consolation, and like Sepia is indifferent but is not aggravated by consolation. So it is a hybrid of Sepia, Pulsatilla, and Arnica. There are lots of emotional symptoms also which you can refer from our textbook. Tubercular-like constitutional venous congestion, extreme chilliness, better by motion like Rustox, emotional diarrhea with sudden urge like jalsemium, strong premenstrual symptom and better after discharge like lechesis, and menopausal arthrosis of legs. These are the symptoms in our Materia Medica. It restores menstruation, amenorrhea due to confinement in prison, camps, flight or travel. Lots of skin symptoms opposite to sarsaparilla. This excess of estrogen makes skin more clammy, more perspiring, and more prone to suppuration. It makes it very delicate. So when there is a lots of delicate skin, it goes to injury fast. So it is totally opposite to sarsaparilla. Breast symptoms also, chest feels hard like a breastplate, sclerosistic mastitis, which is PCOD. So you can refer, but this is a very good medicine for treating breast cancer. And the third and last remedy I will quickly go through is gallium eperine. So gallium eperine is also very good. It is a medicine for Rubiaceae family, the China, Coffea, and Ipecac family. It is also a weed and very invasive plant. It gets cling to the animal passing by to get dispersed. So it is a medicine when metastasis takes place to the distant organs. It is used as a cheaper substitute of coffee and a tonic to lose weight. It is also a medicine for lymphatic drainage and a medicine for calculi. And it is used as a poultice for cancerous ulcers in folk therapy. And if we study the phytochemistry of this gallium eperine, it is very much related to doxorubicin, which is a phytochemically and molecularly, it is related to doxorubicin. Doxorubicin is a potent chemotherapy used to treat triple negative breast cancer. And from Rubia tinctoria, Rubia tinctoria is Manjistadi in Ayurvedic medicine. It is also one of the homeopathy remedy. And from its alkaloids, this chemotherapeutic drug doxorubicin was formed. As I said, that they use these plant remedies, and from there they make this alkaloid. So this gallium eperine is very much related to this doxorubicin, like our Vinca minora is related to vincristine. That is also a chemotherapeutic drug. And again, doxorubicin is also used for triple negative breast cancer. And if you just enter in PubMed the gallium eperine and breast cancer, you will find that it is confirmed. It is well known that it is a very good remedy for triple negative type of breast cancer. It's confirmed. in our homeopathy, it is mentioned very lightly somewhere that triple gallium pyrine is a medicine for breast cancer. And in modern medicine, it is proven that it is a medicine for triple negative type of breast cancer. There are other things also which I have studied, but I will not go into detail. So when we can use gallium pyrine for breast cancer, so it is, see, Goffia is for pain, right? There is excessive nerve stimulation. So when there is a cancer, we can use gallium pyrine when there is excessive mental stimulation, sleeplessness, and so much sensitivity to pain. Ipecac and China and coffee have bitter taste, so confirmatory symptom can be a bitter taste in mouth. The history of intermittent fever, or patient is having fever with along with the breast cancer, and excessive stimulation of mind with abundance of idea and joy leading to restlessness and sleeplessness. So I have treated one cancer patient of tongue with gallium pyrine when there is insomnia, but not due to any other cause or worries. But patient used to think about business and applying new idea with a huge nodular cancer of tongue. And then I gave him gallium pyrine. The cancer was cured, and even patient he started having a very good sleep, and slowly the cancer was cured. So it is a medicine for breast cancer, especially triple negative type, as well as medicine for tongue cancer when these coffee-like symptoms are present. These are the list of homeopathic indications. So, Dr. Yamini, I think I'm done. There are many things to share, but I have given you, and I've shared the things possible in this given time slot. Participants are welcome for any. Hello?
Yes. Yes, ma'am.
Any question?
Yes. Ma'am, I can see some of the questions. I'll read. Okay, so there are two questions. Dr. Alpa is asking, please discuss posology and repetition.
I think we require a separate session for posology and repetition. Okay. Right? But in general, my rule is that I use water potency or LM potency, and I repeat it till the patient is holding the symptoms daily, generally.
Okay, thank you. One more question. Two questions, in fact, but interrelated. Dr. Jyoti is asking, when is your next book on cancer coming?
Yeah, I'm working on mouth cancer. Hopefully 1 year.
Okay. And ma'am, one more question from the audience, that how they can get your book, the existing book on breast cancer.
Yeah, actually it is printed by, it was published by Jain, but currently out of stock, but they are going into reprint. So soon they will come out with another edition.
Okay. Sure. Thank you so much. So you can just check the Jain's website. I guess it is in reprint. So very soon you will be able to get it, and you can order online. Okay. Yeah. Ma'am, one Dr. Dhanya is asking that which books can be read for knowing the phytochemistry aspect of the remedies, of our remedies?
No book, Google.
Google, okay. Okay.
I have nothing to recommend. Yeah.
Okay, so one doctor is also asking, is it possible to cure the breast cancer with phytoleka?
If patient is having symptoms of phytoleka, like shamelessness, generally when we give phytoleka, our first indication or first thought comes when a female exposes breast with cancer in front of everyone so easily, because one of the indications of phytoleka is shamelessness, right?
Yes.
So there is a purplish appearance, it's right-sided, a nightly aggravation. If symptoms agree, yes, it will cure.
Okay, ma'am. Thank you so much. It was a wonderful session. You taught us many basics which we should remember, and also taught us remedies which we do not think about, when we treat cancers generally, like sarsaparilla, you said, gallium pyrine, because we are so somewhat, biased about few remedies which are used generally for breast cancer cases. So that's a good learning, and the takeaway that, we should look for the remedies where such, we have to look the remedy from all the aspects, like the phytochemistry, the toxicology, and, what is the use in the modern
We
medicine
have
and everything.
treasure, Dr. Yamini. We have treasure in our materia medica. We just need to uncover.
Yes, yes, very true. Very true. So, yes. So everybody is thanking you in the comments. I can also see the comments on the YouTube thing. So we are very, very grateful, ma'am. Thank you so much for giving your precious time and sharing this wisdom and knowledge. And if we get more queries for you, I would request you to answer them later, maybe in the panel discussion. So I will just collect those queries and ask you in the last session, which we will be
thank
having.
you. Thanks to you also for inviting me, and my regards to all the participants.
Thank you. Thank you so much, ma'am. Thanks a
And
lot.
I'm sorry for the inconvenience I caused, and I was
No. That's okay, ma'am. That's totally okay. Thank you. Patients always come first for any doctor. So we totally understand that. Thank you so much and have a great day, ma'am.
Bye-bye.
Bye-bye. So guys, thank you so much for joining the session. I hope you enjoyed it. If you have any queries, if you want to ask anything related to this session, related to your cases of cancer or your difficulties while treating cancer, please write back to us on the email which I have given you, or you can just directly DM us, Asha Homeopathic Academy or Vitality Clinic. Dr. Hafiza is also there. You can reach to them and we will have a panel discussion at the end of the series. After 2 weeks, we will be having that, and we will call all the speakers over there, and they will try their best to give the answers to your queries. So do send your queries, because that will also boost our confidence and we'll be able to help you in a better manner. So thank you so much for joining, and do share this wisdom with others also. So kindly share the video. It will be there on YouTube. And see you next week, next Friday. Me, Dr. Hardik, and Dr. Hafiza will be taking the session, and we will discuss do's and don'ts of cancer cases. So see you, everyone. Thank you so much. And bye-bye. Have a great day.